After learning he might have been exposed to COVID-19, Tyler Jewell got tested and waited almost a week for the result.
Definitely started to feel some severe cabin fever within the four walls, and it was starting to take a toll.
The Sydney resident was furious at the lab processing his test, Lavity.
I ended up going to a different laboratory on day 5, and I received that test result before I received the Lavity's test result, which came on day 6. 6 days, I think, really compromises the integrity of the entire testing program.
Since the pandemic started, Lavity has processed almost 6 million COVID tests.
When your volumes of a particular test sort of go up by 8 to 10 times what they were previously, it does put strain on an organisation. Very few companies would go through that sort of growth in volume without having some issues.
The industry got a boost last year when Medicare rebates on COVID tests for private companies rose from $28 to $85. More than 12 million tests have been subsidised, costing close to $1 billion across the public and private system.
We're obviously having a pretty strong period, and pathology is more generally.
Lavity's parent company Helios saw revenue soar to $1.9 billion, delivering profit 1 year after it posted a $70 million loss. Profits also more than doubled for the owner of Douglas Hanly Moir Testing, Sonic Healthcare, and went up by 46% for Australian Clinical Labs.
What we should be asking these companies is to publish their cost of goods. This is not the cost of doing business, this is profiteering.
Pathology testing has been dominant in managing Australia's COVID crisis, with 31 million swabs now conducted. The Health Department says that it provides the most accurate results, but now companies that do far cheaper and quicker tests want in on the action. Workers at this aged care home are starting their shift with a swab that takes just 10 minutes.
It's not replacing the laboratory test, but it's another thing to add to the matrix to increase our confidence. So as you can see, your result is negative.
The construction industry is also trialling rapid antigen tests at 12 building sites across the country. But with no Medicare subsidies, they're paying $25 a swab.
If you look at a project like Sydney Football Stadium, which has 1,000 people on that job, and they're testing those people twice a week, the cost is about $75,000 for that site per week.
They want government subsidies, which the rapid antigen test companies are lobbying for too.
I think reimbursement should be extended to cover all tests that the TGA have approved that are fit and usable, and I don't think it should be reserved purely for pathology-based products.
While lab tests can never compete with 10-minute results, Lavity says it's shortened wait times to no more than 48 hours per test.